The dais will now begin their 5 minutes of questioning, and I recognize myself for my 5 minutes. Mr. Pollack, I would like to begin with you, sir. There have been a number of reports of hospitals purchasing physician practices. In some cases, patients enter the same building and see the same doctor after the purchase, but the Medicare reimbursement rate for the service is significantly higher. In some instances, Obamacare increased these pricing disparities. Are Medicare reimbursement rates driving purchases of physician practices, and do you think that will impact Medicare's solvency?
Well, I think, Mr. Chairman, there are two issues here. One is the issue of physicians wanting to be part of teams and wanting to be part of group practices that deliver care in a coordinated way. And very often they are being part of the hospital entity. And that's certainly a trend that we're seeing. When physicians do become part of the hospital entity and they deliver services within the hospital entity, there are requirements that have to be met that they are part of that facility, as opposed to providing service in their own office or in a different site. Hospital costs for those physicians are legitimately higher, and the Medicare rate does in fact reflect a higher amount. And that is legitimate in our view because the regulatory requirements for practice in that setting are very different than what the requirements are in a physician office or an ambulatory care center. The patients we take care of in that setting is anyone that walks through the door, Medicare, Medicaid. We are open 24 hours, 7 days a week. The patients that are taken care of in those hospital-based physician clinics tend to be sicker, and we have studies that we're happy to submit for the record that shows they're poorer and more economically challenged. They suffer from a more difficult set of circumstances. So it is, in fact, more expensive to take care of patients in those types of settings.
Right. Thank you. Dr. McInerney, would you like to respond to that, please, to my question?
Yes. Thank you very much, Mr. Chairman. I take care of cancer patients in a very poor community in New Mexico, which ranks at the lowest for income. And while the American Medical Association supports the right of physicians to choose employment, we focus on the word choose. We don't believe that competition should force physicians to select employment over self-employment or other options. I do disagree with the statement that we are unable to take care of sicker patients in the outpatient arena. In our practice, if I sold to the hospital tomorrow and I saw the same patient and did the same services, you are absolutely correct. I would be reimbursed at a higher level if I were hospital-based than physician fee schedule. But we do take care of very ill patients, and we manage to keep them in the outpatient arena. The regulatory burden that physicians have is one of the impediments to physician practices. The ability to be able to comply with all the regulatory requirements are one of the barriers that have driven younger physicians in particular to wanting to join hospitals in hopes that someone else will take care of all that and just let me see my patients.
Great. Thank you. Dr. Gottlieb, I have a specific question for you. In your testimony, you stated that there has been a net loss of insurers since the enactment of Obamacare. You also discussed co-op insurance plans that have been subsidized under Obamacare. Can you discuss the success rate of the co-ops insurance plans and how the declining number of insurers will affect competition in the insurer marketplace? And you have about 56 seconds.
Well, I'm referring mostly to the commercial marketplace. There's been no new net commercial insurance company formation since the enactment of Obamacare, actually since 2008. So whatever new plans we've seen, new carriers enter the market, we've seen offsetting losses. And actually, we've seen a loss of new carriers. We've seen new plans enter the market, but they've all been existing carriers that have decided to offer plans on the exchanges. They're not new carriers. So I don't think that's very robust competition. It's an indication that investors aren't allocating capital to start new health plans. I think because of the regulatory impediments and the high costs of getting into the market. As far as the co-ops and the provider-sponsored plans, particularly the hospital-sponsored plans, I think the administration envisions that picking up the slack and providing competition. But the co-ops are all I think, almost all underwater, and one has already declared bankruptcy. And I'm not very optimistic that a lot of the provider-sponsored health plans are going to survive. We've done this in the past, and what's been demonstrated that hospitals don't manage risk well. There's a reason why insurance companies exist.
Thank you.